Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. So in this video I am going to explain about important guidelines for each series like integumentary, musculoskeletal, respiratory, cardiovascular, digestive, then reproductive system, urinary, then neurology, eyes, ear. So up to surgery 6 series I am going to give you important guidelines. So those who are going to write CPC exam, definitely this video will be helpful for all those who are going to write the CPC exams, because for each series they will ask some set of codes. So for that set only, from this important guidelines only, each year, each time, exam time, they are asking the questions. So like one series means definitely they will ask one questions from the repair, one question from the mock surgery, one question from the adjacent tissue transfers. Like that, important guidelines I am going to cover. Those who are going to write CPC exams, please, before you are appearing to the exam, before 1 week itself, please revise all guidelines, whatever important guidelines I shared you, each chapter wise, each series wise. Please revise those guidelines only before appearing to the your exams. Okay, so then I shared some code also. So repeated questions, like every time those who are already attended the exam, those people shared some only hint. So this one, from this codes they ask the question, from this code they ask questions, like that. With only code they remember and they shared me. So those particular codes I shared you in this video. Please go through that particular CPT code, whether any guidelines is there or not, or any included, excluded, what will be the guidelines. So go through it, and description, then parenthetical word, definition of that particular CPT, so what are all the guidelines to that particular CPT. So whichever I shared only CPT code, those are repeated one. Okay, those who already attend CPC exam, they have got the same CPT codes. So those codes are correct code or correct options. So after the exam they are not remembering the full questions, but I informed them to remember only the codes from which section they asked. So like that, from that section wise code they remember and they mocked it. So those codes I shared you, repeated codes. So please go through important coding guidelines by each chapter wise, and what they asked previously. So from that CPT code itself, please check that CPT code, any guidelines or any exclude, include, or any modifier applicable or not. Like that point of view, you have to check with that code only, repeated codes. Okay guys, please watch until the video, because I shared each repeated important CPT code only. Okay, so with that code you have to go through the guidelines. So if it is one set of codes like 4480, like that, if one code is there I mentioned, means go to that code range, check any guidelines is there or not, and check the include, exclude, everything you check, and make it note from this sections. Definitely they will ask the questions. So these are the guidelines, these are the include, exclude, like that you have to read it with that code only. Okay guys, please check the code range itself. Thank you for watching. If you have any doubt, please comment. And so after completing all surgeries, so I will share you 7 series, 8 series, 9 series as well as. Okay, thank you so much.